Hello, hello. Welcome to today's live training, wherever you're watching from, whether you're watching on Instagram, whether you're watching in the Clinical Connections Facebook group, or whether you're watching on YouTube. Welcome. As always, I'm really happy to be here today. Today's topic comes from some things that I've been hearing recently from people in the rehab world, and that is burnout and compassion fatigue. And what I'm hearing is people are using these terms a lot, right? They're, oh, I'm burnout. Oh, I have compassion fatigue. They're using them interchangeably. They're kind of using them kind of on a whim. But the thing is, they actually mean something different. Each of those terms has a different meaning. Um, so we need to understand what each word means in order to figure out the best way forward to finding the solution to each of these phenomena. So that's my goal for today, is to kind of explain the difference between burnout and compassion fatigue and to talk about what we can do about each of those. Okay. For anybody new here, I am Dr. Jody Miller. I'm a physical therapist and a mentor to PT students and new grads. I've worked in just about every setting that there is for PTs, everything from acute care, oncology, outpatient, pediatrics. I've done travel therapy, a lot of skilled nursing, rehab director to skilled nursing facility. I've done adjunct teaching, I've done lab assisting, and now I own my own cash-based practice in Florida, and I'm also the owner of Clinical Connections Mentoring, which is where you are right now. So let's get started. Let's start by defining burnout. So burnout is a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. So it's characterized by three dimensions. One is feelings of energy depletion or exhaustion. Two, increased mental distance from your job or feelings of negativity or cynicism towards your job. And then the third is kind of a decrease or a reduction in professional efficacy, like feeling you can't do a great job at your job. So, burnout is a slow, gradual depletion of your energy and motivation at your job. It's often combined with words, or it's kind of defined by the words being overworked and undervalued. So, if you've ever said, oh, God, I just feel like they're working me like a dog and they don't value anything I'm doing, that's pretty consistent with burnout. Okay. So it's feeling exhausted or having low energy at work, like you have to drag yourself out of bed every morning and you're just constantly tired every day. It's having negative or cynical feelings when you think about your job or even your career. Like you have absolutely nothing positive to say about your job. Or if someone, volunteer comes in or a high school student comes in to observe and they say they want to become a PT, and the first thing that you say to them is absolutely not. You might want to rethink that. It's a terrible career decision. Run for the hills. Right? If you're saying things like that about the career you've chosen, you're probably heading down that path to burnout if you're not there already. It's also feeling like you're not able to be effective at work or have a positive impact on your patients. Like you're unable to help your patients because you don't have enough time with them, or your job doesn't let you be creative because during you can't be creative during your treatment sessions because of whatever restrictions your job has placed on you. Maybe you find yourself doing the same thing over and over and over again with every patient on your caseload every day. You're just kind of dragging yourself along. And you don't feel like you can be effective in your treatment sessions. So the cause of burnout, especially for PTs and OTs, comes from what I call external factors and internal factors. So external factors are things that we can't really change. That's why they're external. So it's things like bad managers, poor management, high productivity standards, low and constantly changing reimbursement rates, low staffing, which results in increased demand on the people that are working there. So these are examples of external factors, right? We cannot change these things. Then there's internal factors to burnout. These are things that we can change because they're within us. So they are things like perfectionism, imposter syndrome, comparison, people pleasing, right? These are all rooted in how we were raised, the social environments that we've grown up with. They're all interlinked and they contribute to each other. Okay, so somebody doesn't just have perfectionism. Someone who practices perfectionism also has a lot of people pleasing tendencies, a lot of imposter syndrome. So these internal factors are kind of all interweaved, interlinked with each other. They contribute to each other. But each of these leads you to feeling like you constantly need to do more in order to be a better clinician, to be a better employee, to be a better coworker. Okay. All of these come from internal feelings. They are things we feel about ourselves and how we feel about ourselves. Okay. Most people will tell you that burnout comes from all of the external factors, right? High productivity, bad bosses, terrible reimbursement, and they contribute to it. I agree. They do contribute to it, but we cannot forget the internal factors. Both factors, internal and external, everything that I mentioned, all contribute to clinicians who experience burnout. Okay. Now let's move on to compassion fatigue. So, compassion fatigue is more specific and it's often called the cost of caring for others. Okay. It's defined as a state of profound emotional and physical exhaustion that results from repeatedly being exposed to the suffering, the trauma, and the distress of others, our patients. So, it's the stress that stems directly from the empathy that we feel and the act of being compassionate toward people in pain. Okay. So it makes sense that we, as healthcare providers in helping professions like PT and OT and speech, are going to experience compassion fatigue. So it does have two components. Burnout is one of those components because stress and exhaustion are present in burnout. The second component is called secondary traumatic stress. So this is the rapid onset of stress that comes from indirect exposure to trauma. So, right, so our patients are feeling trauma. They're in traumatic situations. We get indirect exposure to that, which leads to this rapid onset of stress for us as the clinician. Okay. So it's almost like you're taking on the trauma of the patients that you're helping. So when we talk about compassion fatigue and we define it, the key is to remember that it is trauma related. Okay. So let's compare the two. Let's compare burnout to compassion fatigue. So burnout is about being overworked and overwhelmed by the demands of your job. Compassion fatigue is more about being overexposed to trauma and suffering that you and the suffering that you feel as you help other patients. Okay. So burnout, overwork, overwhelmed by the demands of your job. Compassion fatigue is being overexposed to trauma and suffering while you're helping your patients. Okay. The primary cause of burnout is chronic unmanaged stress from your job due to high productivity standards, poor management, feelings of imposter syndrome, that perfectionism. The primary cause of compassion fatigue is prolonged, intense exposure to the suffering, trauma, or distress of other people. It's constantly dealing with people with MSK, musculoskeletal pain, or those who have lost functional ability because of a stroke or spinal cord injury, or working in pediatrics with nothing but kids with neurodevelopmental disorders. Okay. The onset of burnout is gradually and it's over time due to chronic stress. Compassion fatigue, the onset of compassion fatigue occurs suddenly, right? As soon as you get a patient in a traumatic experience, or it can accumulate over time. If you're seeing nothing but trauma, 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 that can also accumulate over time. The emotions that come with burnout are cynicism, frustration, negativity toward your job. Okay. The emotions that come with compassion fatigue are feeling numb, having feelings of like helplessness for your patients, almost like you're feeling depleted of that ability to care. It also has grief, there's hopelessness, there's anxiety. Okay. So kind of those emotions that come with burnout are a lot more negative, cynical. Those emotions that come with compassion fatigue are more that grief and anxiety and hopelessness. So the key symptoms with burnout are emotional exhaustion, mental distance from your job, decreased efficacy. You're very cynical, you're very frustrated, you're irritated with your job. The key symptoms with compassion fatigue are physical exhaustion, decreased empathy, that feeling of withdrawal. You can't sleep, you have intrusive thoughts, you feel detached from everything. Okay. So see the differences between those two, right? But so if you're feeling cynical, you're feeling negative toward going to work because you're working through your lunch break, you have to document, you have to see 3 patients at a time every hour that you're at work. Your boss is constantly getting on you about your productivity. This is more a feeling of burnout. If you're having trouble sleeping, you're constantly thinking about a specific patient's case and you're grieving for them, you're starting to feel numb, that is more likely that you're experiencing compassion fatigue. Okay. So there is some overlap between the two. And I think it's also really important to note that burnout can be a pretty good predictor of compassion fatigue, or it can predispose you to compassion fatigue. Because if you're already exhausted by feelings of being overworked and underappreciated, then on top of that, you're spending your entire workday treating patients who are experiencing trauma themselves and you're taking on their trauma. There's not much left to protect yourself from that secondary trauma. So that can see how having burnout and those negative, cynical feelings can kind of bleed into compassion fatigue when you're also taking on your patient's trauma. Okay. So now that we know the difference between the two, what are we going to do? What can you do about it? Okay. So for burnout, you have to address the problems that are contributing to it. Sometimes that's addressing those external factors like changing jobs, changing settings, right? Going to a different clinic. You should always, always, always be looking to improve the internal factors that are contributing to burnout. Because if you change the external factors, but you don't address the internal factors, remember they both contribute to burnout. If you do not address the internal ones, that burnout's going to follow you no matter where you go. Okay. So, do you practice perfectionism and what can you change there? Do you experience imposter syndrome? What can you change here? Do you tend to compare yourself to other people? How do you recognize that and how can you change it? So, I've talked a lot about all these topics in all of my other videos, which you can find. And this is what I help a lot of my clients work through so that they can move on from burnout. For compassion fatigue, you need to focus on trauma informed care and use these tools for yourself. Students are starting to learn about it, clinicians are starting to learn about trauma informed care. We need to do a better job, all of us as clinicians, learning about it and using those tools for ourselves. Okay. You need to learn the process of trauma and improve your sense of safety at work and in your career. And this help is going to come from a qualified professional therapist or counselor. Okay. So if you're experiencing compassion fatigue, it's probably time for you to seek help from an experienced professional therapist. Okay. Regardless, both burnout and compassion fatigue are completely normal responses to the level and type of stress that we experience as PTs and OTs. Okay. You are not alone. A lot of other therapists are experiencing these things because by nature, we got into this field to help other people. It's what we do, it's what pulled us into this direction, into this profession. We want to help people. So it's normal for us to want to help everybody else, to do the best we can in our jobs, to empathize with our patients. And with that comes us taking on some of their trauma. But when it happens too much and we don't recognize it, that's when, we can't make changes about it. Okay. We have to be able to recognize it in order to make a change. If you don't make changes, you're going to burn out. And in some cases, that burnout can then lead to compassion fatigue. Okay, so start with recognizing the differences between the two. Is it burnout? Is it compassion fatigue? Determine which one you are experiencing and then do what you need to do to improve that situation. If it's burnout, address all those internal and external factors that I've talked about. And I can, in my other videos, I talk about what you can do about all those. If it's compassion fatigue, it's time to seek professional help from a counselor or a therapist. Okay. If you know that you are experiencing burnout or you want to avoid experiencing burnout altogether, please send me a message. The root of everything that I do with my clients is help them avoid burnout because I want you to enjoy this profession that you've chosen. You were pulled to it for a reason. You're a helper. I want you to be able to stay in this field and do it without feeling burnt out. Okay. You're a great PT, you're a great OT. You deserve to love your job, but also enjoy your free time, right? I have a 6-month program built around helping newer clinicians figure out how to build the career that they want. That starts with choosing jobs that are best suited for you and minimizing that risk of burnout, but it also recognizes the internal external signs of burnout. I help you figure out what is contributing to your burnout, and then we're going to do something about it. My program also includes things like improving communication skills, strengthening clinical reasoning skills, gaining confidence in intervention selection and implementation, improving documentation skills, so much more. All right, so if you're interested in learning more about that, leave a comment below, send me a DM, send me a message, email me. I'd love to chat with you more about it and how I can help you. I hope you learned something new today. Please go ahead and drop in the comments your aha moment, something that really stood out for you, something new that you learned. want to thank you for watching. Again, whether you're watching on Instagram, whether you're watching in the Clinical Connections Facebook group, or whether you're watching on YouTube, thank you, thank you, thank you, thank you for watching. If you have any questions about what I talked about today, please feel free to message me or just leave your questions in the comments. I'll definitely come back and answer. All right, see you next time.